problems of infertility, most of the time I have felt that the person is so crispy for whatever reasons. You can name many of them: fear or conflict with the mother, the father, the husband. But what I feel is that this very strong, crispy attitude that everything that will grow or will be produced will be expelled. So when that relaxes and changes and becomes on a harmony thing, well, there have been several cases of people that got pregnant and got a solid pregnancy.
I believe that what you're describing that way is about the adrenal glands. I believe that it has something to do with cortisol and epinephrine and the hormones of stress that have so many different downstream implications. You know, cortisol, I always tell patients, why do you think you're eating chocolate chip cookies and mashed potatoes when you're stressed? It's because this hormone is being secreted in your body that's asking your body to feed it sugar. It's not asking for protein. It's not asking for hard-boiled eggs. It's asking for cookies and chips. So I believe that one of the critical steps in the stress pathway is the adrenal hormones. There surely are so many others, but those have been described in the fight or flight mechanism, which is what we adapted to as, you know, ancient creatures to be able to survive. If you had that stress, if you had that mechanism to respond to stress, you would survive. And if you didn't have that mechanism, you would have perished.
Right.
From an evolutionary standpoint. So I think that's one of the steps in between, but that's very primitive thinking, and we don't have studies that show us for sure that it's playing a big role, but that's kind of my theory.
It's interesting because it makes me feel, I get back the question about what is first, the egg or the hen. So what is first, a particular state of mind or an approach of life that produces a change in the endocrinal chemistry, or is the endocrinal chemistry that produces a change in the attitude? And I think it's still an open question for both of us. But what is very clear is that in both cases, you can produce a healthier change in the body, either addressing the chemistry by adding something that is missing, or you can also address it by changing it, producing this other, I call it relaxation or harmonization, for call it some way. So even if we don't have the answer, the patient can turn into a better, into a healthier state for either ways. And you know, I call it harmonization because it's kind of a personal semantic, because when I feel those patterns and those colors inside the person, someone asked me, how do you know which ones are harmonic and which ones aren't? You know, maybe you see something and that's good, and how do you discern about that? And the first answer that came when I got that question is that I asked back the person, how do you distinguish what is harmonic? When you hear someone singing a nice melody, or when you hear a scream of pain? So it's kind of a natural logic, or it seems to be like a certain kind of natural way of what is healthy and harmonious, that maybe we cannot totally englobe and understand, but you connect more like a feeling for that. And it was around 90-something when I started my practice that I got to work with this old woman that she had cancer in the liver. And it's always, you know, I don't advertise my work, it's always the chain of the results and word to mouth. So I remember that I was saying what I was seeing, and it happened that the son of that woman was a pathologist. And he bring a book about the cuts, you know, for the microscope for analyzing tissues and cysts and tumors. And for me, it was a very strong shock to see that the way the cells of the tissues appear in those pictures were the way I was seeing them in this kind of a special state when I'm working. So it seems to be at least a certain aesthetic of what is inharmonic. I don't know exactly now how, but that could help to maybe make a bridge between those two ways of approaching, you know?
Well, I mean, I think it's in a similar way, by touching a person, by taking their pulse, by touching their heart, by doing some of the things that we do as part of a regular physical exam, you can definitely have a sense of whether they are relaxed, whether they are stressed. I mean, there are certain qualities to the sound of the heart, to the feel of the heartbeat, to the feel of the pulse, to the skin. Even just watching somebody's muscles or touching their muscles, you can feel that. Yeah. So, I mean, there are certain physical findings that go along with that too. Yours are more tactile, I think, than ours may be, but.
Yeah. When I'm doing a healing, I'm putting my hands mostly on the central line, around the main organs, the head, the back, around the spine. Sometimes the person has a diagnosis of a problem on a certain part of the body, but it's not always about going for that part of the body and apply the hands there or send the flow of energy there. Because my approach is it's without the script. I just, the same way you see an image and you feel that there are some gaps that needs to be filled, I just flow during 1 hour and a half toward, I'm called to work. Most of the time I don't have a real, at the moment, clue of what is happening exactly. It's kind of making a puzzle, and then just at the end of the puzzle, you have the general image. And so that's what I think it's also something that I have taken as an approach of life. Most of the time, you don't need to know before feeling it. Or you need to know something and completely understand it for feeling it. Most of the time, feeling it is the missing part of the puzzle to finally understand it.
Well, I've been very lucky to train at New York Presbyterian Hospital, where I've had some incredible role models in doctoring. And I think that over the years, I had the background of Western trained evidence-based medicine, the way we learn medicine, based on clinical trials, based on experience, clinical judgment. But one of the things that always motivated me was understanding why the patient came to you at that point in time. What was it that really brought them to you? And a lot of what we do in medicine is really understanding not only the pathophysiology of the disease, but understanding where that patient is in that point in their lives. What is it that they're really worried about? And I found that if I really tapped into that, not necessarily only the evidence or the evidence-based facts, but who that person was at that point in time, why they were coming at that point in time, that it really enabled me to get to the bottom of the problem and maybe really to explain to them what the problem was. So there's the physical problem that you have to evaluate and assess with testing and and very objective data. But there's also the subjective, and it was always interesting to me that the person who came with chest pain on the day after a family member had a heart attack, well, that just seems too much of a coincidence. So I tried to educate people as to what motivates, why they feel the way they feel at times, physically and emotionally. And I just found that I could reach out to people and help them heal themselves, really, by giving them some understanding of that. So I think that's been one of the most satisfying parts of medicine.